here. The biggest topic that has been on everybody's mind, obviously we're kind of living in it, is in light of this current COVID-19 pandemic situation. We kind of see the importance of telemedicine and the importance of teleneurology kind of step up to the plate, and really it's been showcased so much more now than ever before. Can you talk more about how telemedicine is being utilized to not only diagnose but treat sleep apnea and other sleep disorders?
So you are absolutely right. The COVID-19 pandemic has really accelerated what was probably going to happen anyway, but now has made it kind of happen more globally in terms of our use of telemedicine, virtual patient visits that really allow us to, in a more seamless way, really see our patients without having them needing to come physically to see us in clinic. So we can, right now, what we're doing, as most of our patient visits have been converted to virtual visits, where, just like you and I are doing right now, we talk to our patients, we try to understand their symptoms, their medical history, their medications that they're taking, their comorbidities and other medical issues that they have. And we can even do a cursory, even physical examination, even virtually, and have the ability, in some cases, to monitor blood pressure and some other physiologic parameters that really then allow us to provide, pretty good care for our patients in a more expedited way, enhancing access then to clinicians and allowing us to really be able to care for more patients. So this pandemic has really accelerated that. And here at the Cleveland Clinic, this is something we were already doing. So we had the platform in place. And given that we had the platform in place, the transition to this virtual visit sort of paradigm has been a lot easier for us to sort of accommodate. There's still some, because of the large volume, there are still processes that we are smoothing through, but in general we have really been able to accommodate seeing our patients virtually, make decisions on their clinical care, and implement medical decision making based upon our encounters in terms of treating our patients with sleep disorders.
And obviously, you mentioned how, and we've covered it too, how Cleveland Clinic especially has been at the forefront really of this kind of telemedicine and teleneurology wave, especially over the past couple of years. Do you feel as though that, especially with something that's going on right now, this is, and like you said, accelerated process, do you feel as though it's only going to make the standardization of telemedicine even quicker than what it already is becoming right now?
Absolutely. I think once restrictions are lifted and we start to have the ability to see our patients in our clinics, I certainly think that for the more complex patients that have a lot going on, and patients for whom we really need to make sure we're doing an in-depth physical examination or getting really reliable vital signs and those sorts of things, I imagine in those cases, one-on-one visits would be in the clinic, would be, of course, very reasonable. But as we had both discussed, that, given this acceleration to the use of telemedicine platforms, I certainly think that this will be a large part of how we are going to be caring for our patients. Not to the low degree before the pandemic, not to the great degree as we are doing during the pandemic, but I think probably somewhere in between, and where that falls, I think, remains to be seen.